welcome you back to In Focus. And we have with us, of course, on this Thursday and every Thursday, our In Focus health correspondent, Lenore Madu. Welcome again. What do you have for us today?
It's great to be here. Well, today we are looking at a new report from UNIFEM, the UN Development Fund for Women, which says that too little is being done to advance women's rights and their well-being. The United Nations says that this lack of progress in improving women's status could also affect longer-range goals of reducing poverty and infectious disease. Voice of America's Caroline Weaver has more.
The report is called Progress of the World's Women 2008, Who Answers to Women? It says the key to improving women's status in politics, health, and economics is accountability, holding governments and officials responsible for their actions. UN Secretary General Ban Ki-moon.
It is deeply symbolic that the report is launched in the same week as the world observed the first International Day of Democracy.
The Secretary General said that maternal health is one of the most troubling areas where progress has been slow.
It is unspeakable that one woman dies every minute from pregnancy complications or childbirth. This is a silent emergency. Yet there is no mystery behind this death. To fix the problem, we just need is to ensure that developing countries have what developed states provide at a minimum: prenatal health care and skilled attendants to help mothers survive the ordeal of labor.
Anne-Marie Goetz of UNIFEM wrote the report. She says the lack of progress in improving women's status could mean that the UN's Millennium Development Goals, which include reducing poverty and infectious disease, will remain unmet at the deadline of 2015.
Gender equality cross-cuts all of these goals. And if you want to reduce poverty and hunger, if you want to increase employment that yields a wage that can generate savings, if you want to reduce child and infant mortality, if you want to reduce maternal mortality, etc., women must be empowered, because women's income is often used for the well-being of the family and the community.
3 activists from India were also at the UN event to underscore how government accountability helps poor communities. Their group in Rajasthan, the Mazdoor Kisan Shakti Sangathan, helped pass a right to information law for all of India. The group used one of its signature puppets to demonstrate how their village public meetings are run, asking the Secretary General about international aid money.
You send this money for poor women, child? Yes.
The UNIFEM report notes one bright spot: substantial progress in education for girls around the world. It also covers problems of violence against women and the use of sexual coercion, and calls for more all-women police units, like a special Indian force that was sent to help quell violence in Liberia. Caroline Weaver, VOA News, New York.
On Wednesday, the United Nations unveiled its 2008 State of the World Population Report. The report finds that some cultural practices can be harmful and may lead to violations of basic human rights. Joining me to discuss the report is Dr. Asa Karam, Senior Culture Advisor at the United Nations Population Fund. Dr. Karam, welcome to In Focus.
Thank you for having me.
Tell me about the impact of culture on an issue like maternal and reproductive health, for example. How is culture impacting this issue?
Culture is absolutely critical. It is the foundation upon which any of our ideas, it's the way we think, behave, and believe, and what we believe. And therefore it runs through everything that we do. It shapes our attitudes, our behaviors, our ideas about certain things, and it is therefore something that we cannot, in a sense, avoid. It's related to why some women, for instance, would choose to give birth in their homes, in spite of the fact that not too far away may be the very high-tech facility, or even just the very basic medical needs and skilled attendants that they actually require. They will still choose to give birth at home. It is also why some women Mothers-in-law, for instance, will not allow their daughters-in-law to go to the clinics when that's necessary to give birth, because they figure they were able to give birth alone at home. Why should this daughter-in-law be treated any differently? And a number of other practices like this, which has eventually meant, in some instances, translated into actual deaths, because as we know, there's one woman dying every minute somewhere around the world as a result of pregnancy or complications immediately thereafter.
Now, we don't have much time, but tell us how we can use culture as an agent for change, positive change, and help these women actually improve their lives and their health.
Well, as we said in the United Nations Fund Population, for Population, the report that just came out on yesterday that we launched made it very, very clear that you have to work with what we call cultural agents of change, the people who impact on the way we think, believe, and behave. In many instances, these can be either faith-based organizations or community leaders or people who influence the way that we think and we feel. They could be just activists in the community, they could be political leaders, they could be civil society leaders, they could be faith-based communities. We need to work with them, and now more than ever, when we have very few resources or there's a limitation in the number of resources that are going to be available for overseas development assistance, now more than ever it is important to rely on local community, local actors, in order to make sure that we can get the messages across that women's health and the health of mothers is absolutely critical to development.
Now, how difficult, real quickly, how difficult do you find it to be when it comes to convincing people to change their behavior, considering culture is such an important part of people's life?
It is exactly. You've actually answered your own question, because precisely because culture is important in people's lives, it is not only a matter of difficulty sometimes, and in fact most of the time, the cultures that present us with problems or that have challenges within them also have the solutions within them.
Okay,
so
Dr. Kazam, unfortunately that's all the time we have. Thank you so much, and we hope to have you back for more.
Thank you.
For more information on these stories, go to voanews.com/TV2Africa. It's time for another break, and when we come back, the big impact of the little device, the mobile phone.